Successfully broadcasting a major live sporting event requires a control room capable of viewing dozens of different camera feeds at the exact same time. If a wide receiver steps out of bounds on the far sideline, a camera positioned behind the opposite end zone will miss the action entirely. To capture the whole story, one angle is never enough. In a medical setting, your heart is the star player on the field. To monitor how it's performing from second to second, doctors give it the same multi-camera treatment. A 12-lead ECG is a 12-camera live broadcast of the heart's electrical system, recording every signal onto a single piece of paper. Your heart is a thick, three-dimensional muscle powered by an internal electrical circuit. This current travels a specific path, starting at the SA node, which acts as a natural pacemaker, and moving to the AV node, which relays the signal to the main pumping chambers. Electrical failures, like those seen during a heart attack, are often highly localized. Tissue damage can be confined to the bottom floor of this 3D structure, the sidewalls, or the front surface. Historically, doctors had to capture these internal electrical pulses using massive machines and sensors placed entirely on the outside of the body. Because you cannot inspect every side of a house by only looking through the front door, doctors use multiple sensors to ensure no electrical failure is hidden in a blind spot. The process begins with electrode stickers placed on the patient's arms and legs. These create the hexaxial leads, a series of electrical viewpoints that function as the stadium's sideline and blimp cameras. These cameras view the heart along a vertical plane, looking at it from the top, the bottom, and both the left and right sides. This provides a 360-degree vertical view, but it leaves a structural blind spot on the front surface of the heart. To see what is happening in that anterior or front-facing area, doctors need a different set of angles. The precordial leads consist of 6 electrode stickers wrapped horizontally across the left side of the chest. These act as front-row, field-level cameras, capturing close-up action shots of the electricity moving through the front of the heart tissue. By combining these chest leads with the limb leads, the medical team surrounds the heart with a complete spherical grid of observation. These static cameras record invisible electrical pulses through a predictable physical reaction. When the heart's electrical wave moves toward a camera, the machine draws an upward spike, known as an R wave. As that wave passes the sensor and moves away, the machine draws a downward spike, called an S wave. Because every camera sits at a different angle, the same heartbeat will look like a mountain to a camera in front of the wave and a valley to a camera behind it. These squiggles are physical maps showing the direction the electricity is traveling at any given millisecond. This image shows a standard ECG printout. The grid is filled with sharp ink lines representing the patient's heartbeat. Each row corresponds to a specific camera angle. For instance, the row labeled 2 is a distinct viewpoint from the row labeled 3. Doctors scan this wall of monitors to look for visual patterns that deviate from a normal heartbeat. These feeds are grouped into clusters that observe specific neighborhoods of the heart. Doctors check these groups to see if electricity in one neighborhood behaves differently. Leads 2, 3, and AVF serve as cameras looking at the heart's inferior floor. If the mountains and valleys appear abnormal in only those 3 feeds, the doctor can localize the tissue damage to that bottom floor. If the chest cameras look healthy at the same time, the medical team knows the front of the heart is unaffected. They can identify the site of a heart attack by comparing these angles. The next time you see these lines of medical squiggles, remember that they represent your medical team checking every angle to ensure the heart's electrical show is broadcasting exactly as it should.
If you think video is good, like the video, share the video with your friends, and subscribe the channel. Thank you for the watching.